not a Ketorolac, not a acetaminophen, not a nothing. I have counterparts that just have little ouchies and boo-boos. Norco, Dilaudid, morphine, not an. I
Mm.
never received nothing for my pain that entire ordeal. Never
Wow.
received nothing for my pain.
This is the All One Nurse podcast, where we are bridging the gap between the stethoscope and the soul and getting back to the human side of healthcare.
Powered by Riverside.
Welcome back to the All One Nurse podcast, where this space is just for you, where faith meets mentorship, and every story reminds you or reminds us why you chose this calling, or maybe nursing chose you. But did you know that the NCLEX exam is expected to add a remote at-home testing option in 2026? According to the National Council of State Boards of Nursing, the NCSBN, and Pearson VUE, nursing students will be able to choose between traditional test centers and a secure, remotely proctored exam from home. And even nurse.org has confirmed this. Well, welcome. Today, I'm joined by Bria Burley, who has her master's in nursing as a nurse educator, and she is the founder of RN Prep Bestie, and she's built a tutoring platform that's transforming how nursing students prepare for the NCLEX, how they build confidence in their clinical judgment. And Bria's story is one of resilience, innovation, and heart. She will tell you she's not just teaching you how to pass NCLEX, but she's teaching you how to be a whole nurse. And that is what's needed when you feel like you're being pushed through the nursing program. You want to be confident in the information that you felt like was thrown at you, and you were jumping hurdle after hurdle. And now you're facing this big exam. It's not just about passing tests. It's about safely taking care of people with compassion and with competence. Now back to Bria. Since 2020, she's helped countless future nurses overcome test anxiety, master study strategies, and believe in themselves again. How awesome is that? Her work is just more than tutoring. Again, it's mentorship, it's empowerment, and a reminder that your story as a nurse is worth sharing. Before we connect with Bria, I'd love for you to go ahead and subscribe to All One Nurse, whether you're listening in on Apple Podcasts, Spotify, YouTube, Amazon Music, wherever you're tuning in from. Go ahead and subscribe, because when you subscribe, you're letting others know that this podcast is worth listening to. And it allows me to find the yous out there, the other yous out there that need to get this information as well, and listen into these nursing interviews that are literally changing lives, because you get to see that, hey, you're not alone. Now, stay tuned to the very end so that you don't miss what's ahead. And I'll share some updates about our mentorship, our community, and some upcoming resources, and how you can connect directly with Bria, whether it's through her social media or booking her services. Now, as you get settled and ready to just tune in, just know that this episode is a special space for you, especially if you're getting ready to face Goliath, better known as NCLEX, or if you're preparing to battle him again or again or again. Just know you are exactly where you need to be, and that is right here. And if you ever need more reassurance, check out other All One Nurse episodes, because they're here to remind you that you are never alone on this journey. So let's tune right in. Let's dive in with Bria. Yes. Okay. Hey, Bria, how are you doing?
Doing great. How are you?
I'm doing great. I'm so glad to have you here on the All One Nurse podcast. Finally.
Yay!
Yes. Yes. Now, as always, you got to tell us, Who are you and what inspired you to choose nursing?
Okay, my name is Bria. I have been a nurse going into my 10th year of nursing next year. I'm
Yeah.
so excited. I am also a nurse educator. I educate nurses and training, and I also tutor nursing students and prepare graduate nurses for their NCLEX examination. What inspired me to be a nurse is pretty simple. My mom is a nurse. So there's really no like spectacular story. I will just be honest. And I just kind of feel like it was maybe just divine, destiny for me to become a nurse because it's really just shaped the person that I am today. And I love it. Like being a
Yeah.
nurse is the core being of who I am and it has shaped me into who I am today. And it has taught me so much about myself, like who I am as a person, my passions, my morals, my dreams.
Yeah.
So I love it.
Awesome. Awesome. Now tell us, I know you have your master's, but tell us a little bit about your nursing journey, how it began.
Okay. So, of course, when you get out of nursing school, they tell you, oh, get your feet wet, go to the hospital, right? So, I did my due diligence. I started in the hospital. I worked on oncology med surge unit for
Okay.
a very short period of time. I did not stay in the hospital long. Quickly realized that it just was not a
Hmm.
fit for me. And it wasn't a fit for me because of like the politics. When
Hmm.
I when I saw my mom as a nurse, like my mom was my school nurse all throughout my life. Like every
Wow.
school that she worked at, I was there, right?
Hmm.
So she was, a school nurse. So it was caring. It was like that one-on-one care. So here I am, little girl thinking like, oh, that's the kind of nurse I want to be. So I get thrown into the hospital. You have this ratio of patients, and then you start to
Yeah.
learn like the politics more so like get them in, get them out. I
Yes.
wasn't getting that one-on-one care. And then you got a chart every hour on the hour. Like, when do I have time to sit and be with my patients and really cater to my patients? And I had one really traumatic experience. And after that, I was like, okay, this is just not it for me. Like
Mm.
I put in my 2 weeks and I was like, I went into depression. Like I went into an actual
Wow.
depression. Yes, I went into a depression because of that experience in the hospital. I had to make like a decision that I did not agree with ethically and morally. And I was like, okay, this is not a fit for me. So I left the hospital and I went and I was a school nurse. And I went and became a school nurse. I was like, let me just do what my
Yes.
mom did, and I
Yeah.
loved it. Oh my
Yeah.
gosh, school nursing was it for me. But then I realized I'm bored. There's nothing to do
Wow.
here. There's no challenge. There's no nothing like, and I was at like a very small school, it was only 500 students. And like, I mean, it was so small. I knew every single student's first and last name. Like I was that type of nurse. And then I couldn't sit still. I'm walking around the
Okay.
school. I had to find stuff to do. I have a principal and she was so cool. She let me start a program. It was called Clinic Helpers. I bought 4 lab coats and like the students had to make an application. They had to fill it out. And so like twice a week they would come to the clinic like during recess and I would start teaching them how to do things. These were 4th graders that could take manual blood pressures, check your
Wow.
temperature. I had them doing like the vision, the scales, taking the weights and
Love
stuff, like
it.
the hearing and vision exam. It was so much fun because I just couldn't sit in that clinic. It was no windows. It was small. Like I made the most out of it. I loved that experience. And like some of the students that were in that program, I still know them to this day. They're all juniors and seniors in high schools. They're my mentees.
Wow.
Yeah, I've known these girls from like 4th grade and now they're about to graduate high school.
Yes.
So I love that experience. And then while I was doing school nursing, because I had so much of that idle time sitting in the clinic, that's when I went back and got my master's degree. So while I
Gotcha.
had like the slow days, doing my papers, typing my
Hmm.
papers, doing my, all the coursework for getting my master's.
Hmm.
Then also, because with the schools, it's like, 7:30 to 3:30. That's when I started doing more home health. So that's when I started doing home infusion nursing because that started to
Wow.
come about. And that's actually something that I still do now. So almost about like 8, 9 years ago, I started doing home infusion therapy where I was administering like IVIG. I don't know if you've heard of that, like the immunoglobulin and like the biologic medication. So I would get off from from work at the school, and then I go to somebody's house, start their IV, and give them their treatment. So I've been doing that as well. And then
Wow.
I started doing research nursing. Then I was like, ooh, I was doing so many things. I'm collecting
Yes.
breast milk, running to get dry eyes, putting the breast milk on
Wow.
dry eyes. I was working with the kids that had like Duchenne's, muscular dystrophy, and giving them like
Wow.
the trial drugs. I did everything. I was trying to
Wow.
figure out, like, I really kind of did a lot of different
Mhm.
things in nursing, trying to figure out like what my niche was. Cause
Mhm.
school nursing kind of was like, I enjoyed school nursing, but like I said, I wasn't bored, but I wasn't challenged. And I'm the
Wasn't
type of person that I
Yeah.
constantly need to be challenged. So I was in
Yeah.
school nursing, had all these side jobs.
I
And I
love it.
guess what stuck with me after, doing that program with those students, the clinic
Mhm.
helpers, that's when the education kind of stuck with me. Because getting my master's,
Yes.
you can either become a nurse practitioner, you can work in administration, or you can do education. And then I was like, okay, I think I enjoy teaching because it was like the way that I teach, I felt like the students the information stuck so easily and so well for them. And I enjoyed teaching. So
Yeah.
eventually that's the route that I took. So and I'm pretty sure there's
Wow.
many other things that I've done as a
Yeah.
nurse. I've done so much. And then when the pandemic hit, I went back to the hospital, but instead of doing like, med surge, I went to the rehabs. I enjoyed doing the rehabs because I really enjoy watching people
Wow.
rehabilitate themselves,
Yes.
go from like one stage to the next. So I worked in rehab hospitals during COVID and still was doing like the home infusion therapy and stuff. Yeah, I've done a lot of different
That's
stuff. And I'm
awesome.
pretty sure
That's
I'm leaving some
awesome.
things
Yeah.
but I have a
Well,
wealth of knowledge, which is necessary as an educator, right? Like, you gotta be able
yes.
to, know so many things to teach them to your students. So,
Yes.
that's a little bit about me. I know I said a whole lot already.
Well, you took the words right out of my mouth when you decided to go back to school because, like you said, you weren't being challenged, even though you loved your role as a school nurse. And then I also love that, and I commend you for stepping away from the hospital setting because it wasn't for you. And no, and then your mom kind of paved the way too because you got to see her experience as a school nurse. And in your other roles outside of the hospital setting, you're letting nurses know that, hey, the hospital is not the only place that you're limited to. And unfortunately, it's like a lot of times, and I've been in the hospital all of my career. And so with that, it's just nice to hear you talk about your different roles in the community with research, with IV infusions in the home health setting, other than just being a home health nurse, right? So I just really enjoy hearing a little lot about you. That's awesome. That's awesome. And that does make you well versed in what you actually do now as an educator. So that's awesome. That's awesome,
Thank
Bria.
you.
Yes. Now, for my new nurses or my nursing students, because I'm always trying to get advice for them, words of encouragement for them. What were some of the challenges when you were going through nursing school? And I know you definitely, and it may not even be just your challenges, but some of the challenges that you see now with helping students. What would you say some of those challenges are?
It's my favorite
Yes.
question. Okay, so in nursing school, in these programs right now, the thing that gets me, this program, everything that students have to learn, the amount of time is not long enough, in my opinion. I'm sorry. It's just not, you have to learn so much
Yeah.
information in a short period of time. Where do we build critical thinking skills? Where do we
Yeah.
truly build application? Then they got to
Yeah.
graduate, then they got to take NCLEX. And what is NCLEX about? Application. All the students learn is to memorize and flashcards and recall and learn and knowledge, knowledge,
Yeah.
knowledge. All they know is textbook.
Yeah.
When do y'all learn how to think like a nurse? That was the
Mm.
challenge. Because the
Yes.
questions, the students that always come to me, they're always like, they can tell me up and down, night and day, right and wrong, highs and lows, all of like the textbook knowledge. But
Yes.
then you give them a question like, hey, as a nurse, what do you do first? Or which one of these interventions do you need to do for this patient? They don't know. I don't know what to do. How is that?
Yeah.
You know what I'm saying? So that's the
Yeah.
challenge because, like, in anything in life, when it comes to like growth, when it comes to like
Mhm.
cognitive growth, it takes time. It takes time to build. And then when the students are telling me about their experiences in the universities, in their nursing program, where are our educators doing that for the students? You know what I'm saying? Like I hear my students say, oh, my teacher tells me to go look in the book, or you need to go figure it
Mhm.
out, or we got to teach them something. Like, where are they
Come
going to
on.
get that? You're going to throw them
Yeah.
out there and they're going to look at their patients. These are human beings that have they're just not one note. No person is one note. We're not one
Mhm.
note. They have to learn that. That's part of nursing. You have to piece it
Yes.
together. You have to look at all the signs and symptoms, all the lab values before you give a medication, before you implement anything. And that's not something you can just do from a book and
Yeah.
just
Yes.
you can't
You're
get that.
correct.
That's the biggest challenge. You know, you can have all the knowledge, but if you don't know how to apply it, you're really not doing nothing. You can't do anything.
Nothing at all.
So that to me is the biggest challenge.
I love how you articulated that because that is very true. And I know that we had to do a lot. You know, it's like it is a lot of content. It's a lot of information when you're not, um, when you're brand new coming into nursing. It's just different.
Yeah.
But like you said, now it's like information just like thrown at them, and it's like truly jumping hurdles. And before the dust settles, and then the students are more stressed about passing and also stressed because they know they're not retaining the information the way they should because it's just moving so fast, and they get to NCLEX, and unfortunately some of them do not pass. And then for even the ones that do get your NCLEX, but then you get to the bedside and there is no application. And I tell them this: clinical judgment. Clinical judgment. Instead, it's like they're trained to check off tasks. Like they're task oriented when they get to the bedside, especially in a hospital setting. And it's like, oh, okay, well, I need to just do this, do this. But really, you may not be able to do one thing because of something else that's going on with your patient, but you're unable to use clinical judgment to see the full picture. So that's definitely a big challenge. A big
Yes.
challenge. And there's a lot of programs out there. A lot of programs. And I remember for me, it was one of those like always pay attention to their pass rate, like their NCLEX pass rate, to know if that's a good program or not. Nowadays, and you've mentioned it even on one of your TikToks about like they learn how to take the test, or they want to do all these things to learn how to take the test and just want to pass the test. But it's not about just passing, it's about understanding the content. So, what is it?
I think it's more than that. Like, so it's like the culture that they learned while they
Mhm.
were in school, like the cramming, the tests, the anxiety, the quick shortcuts,
Yeah.
what you just need to learn to pass this test. You don't need to learn. When I taught, so one of the jobs that I left out of the many jobs that I did teach in a university. I taught in a
Mhm.
nonprofit LVN school. My students would literally come to me and say, "What do we need to know for the exam? You need to know everything. What are you talking about? What
Yeah.
do you mean? What specific electrolytes do you need to know for the exam? You're going to be a nurse." So yeah, it's not about, and I know I'm kind of, when I get passionate, I get a
Yeah.
little, I get a little,
Yeah.
so the Leo in me comes out. I get a little
Come on.
So it's like, no, it's not about passing the NCLEX. It's about you're about to be a whole nurse. You're about to go out here and take care of real life people with real life issues. They're sick. And these
Yes.
people don't know nothing about nothing. They're
Yeah.
sick and they're depending on you. So no, it's not. When I teach my students, it's never about this is the question. I don't even use the term NCLEX when I teach my students. I said, this is the patient scenario. This is
Yeah.
your patient. How are you going to care for the patient? I don't even use those terms when I teach the students. I always phrase it to like, this is your patient. How
Yeah.
are you going to care for your patient as the nurse? I stray away from the terms because it's like they get so focused on that, like the scrolling
Mhm.
dopamine hits that we get now, like that quick stuff, like that's what
Mhm.
they want. They want the quick, cute
Yeah.
question banks. They want the quick scores to let them know their progress. Am I doing good or not? And then
Mhm.
these question banks now tell them, "Oh, you have a high chance of
Yeah.
passing. You have a high chance of passing," and
Yeah.
then you don't pass.
Yeah.
But then they come to me and they're like, "Oh, what do you do?" I break it down. I simplify it. You
Yeah.
probably only going to do 50 questions this week. 50 questions? That's all I'm doing in a week? Yes. Because if you have the mindset to think like a nurse, you ain't got to do 50 million questions in a week. You
That's
only need
it.
to do a handful. They don't
Yeah.
like that. They
Yeah.
don't like that. They're scared. They're like,
Yeah.
this is not what I'm used to. But if you change, if you're doing something that's not working, you're getting the same outcome, you need to change the way you're
What you're
doing it and you
doing.
might get
Yeah.
a different
Yeah.
outcome. Like, you guys got to start thinking like real nurses is not about the questions. The
Yes.
questions is for practice, but
Yeah.
the mindset is what gets you to pass. Y'all got to
Yeah.
start thinking like real nurses. These are real life people. These are real people. The textbook
Yeah.
breaks everything down, but people in the real life have multiple issues going on all at once.
Mm.
Like your patient's high blood pressure and their sodium lab value could be totally connected to something else that they have going on. If they had a brain injury, the sodium
Yeah.
level could be thrown off, not just because of their hypertension. It could be the brain signaling.
Injury.
It could have injured their
Yeah.
pituitary gland, their hypothalamus, and that could be why they're having the fluid shift and the
Mhm.
imbalance. But you got to look at the whole picture to
Yeah.
even understand that. But
Yeah.
y'all so textbook. They see
Mhm.
brain injury and they automatically ICP. And I'd be like, what
Yeah.
in this question says ICP? What are the vital signs? And they'd be like,
Yeah.
what are the
Yeah.
signs and symptoms of ICP?
Yeah.
I'd be like, that's not even in the question. You're still focused on the
Yeah.
textbook. You didn't
Yeah.
even think.
Not
So
even thinking about the patient.
not-
And
they're so textbook.
yeah. It's so funny you said that. I remember when I was doing clinicals, everything was sepsis. Everything was I said, no, bring it back. Bring it back. It's not always sepsis. Let's talk about it. So it is so funny that you said like they always go to the worst case scenario. And I'm like, no, bring it back. It's not sepsis. I want y'all to come in. And before you even get to sepsis, we got to get to the root cause analysis of why this
Ooh,
patient is becoming.
hard.
Yes, like let's
Ooh,
get
figuring out
there.
what's wrong. Ooh, like,
Yes. Yeah.
you would think that'd be the
Yep.
first thing you would want to do, right? But
Yeah.
and that's the thing, but they're not trained to do that. They're so
Mhm.
focused on like we just had to learn all this stuff in the
Mhm.
textbook and like in the keynotes and
Yeah.
these notes and this book that just tells you
Mhm.
just a few things. Don't
Yeah.
ever come to me and be like, well, I just need to know exactly what's going to be on this exam. What? No, you need to know everything. And there's
Yeah.
no cheat book for NCLEX. It's an adaptive exam. And there's no cheat way to be a nurse. You
Yeah.
have to know it
That's
all.
true.
And you have to want to know it all. Like you should be
Yes.
excited to study about
Yes.
the body. You know what I'm saying?
Yes.
Yeah.
Yes. But they have to wanna okay. So I did a career fair.
Hmm.
And this was high schoolers. I'm like, hey, just let me in the room. I just want to pour into others. And so a lot of them wanted to be nurses. And so I asked them, but when I asked them what did they want to do, and they would say, I want to be a travel nurse. I want to be a travel nurse. So I was like, okay, so what makes you want to be a travel nurse? And of course they say, well, they make a lot of money, or they'll say the money, be money. And I said, well, before you become a travel nurse, you actually have to be a nurse. You have to figure out what type of nurse you're going to be. And you have to be the best version of that nurse so that then you can take those wonderful skills and travel and take care of patients in different locations. And they're just like,
Hmm.
I'm like, yes. So travel nursing is not a specialty. It's the type of nurse you want to be. And so it was just interesting because every single one of them, maybe with the exception of a few, knew like they wanted to do pediatrics or something like that. But most of them, I want to be a travel nurse. Okay, well, I hope you don't go get your NCLEX and just go travel because you're going to be the most dangerous nurse out there.
Where's your passion? Like, why do
Yeah.
you really want to do this? Because if it's fueled by financial
Mhm.
freedom, I mean, we all want financial
Yeah.
freedom. I
Yes.
mean, we all deserve financial freedom, you know what I'm saying?
Yeah.
If that's what this country was built upon, but don't get me into
Mhm.
that. But it's just like, don't get me started with that. But it's just like, that cannot be why you want to be a nurse.
Yeah.
There's no way that you can go through the program, this rigorous, this is not easy work. Like you
Right.
can't go through this just because you want financial freedom, you
Mhm.
want to go to Turks and Caicos, you want the
Dubai.
Chanel,
Come on.
you can't if that's you, then this is because you have to be empathetic, you have to care for others sometimes more than you care for yourself. Like
Mhm.
this is a different type of profession. You might want to go
Yeah.
do something else that might get you some a little bit faster, a little bit. You might
Yes.
want to go work in a corporate world where you don't have to be, so because
Yeah.
this job requires all the things.
Yeah.
all the things out of somebody. You have to be emotionally there
Yes.
for people.
Yes.
Sick people, they don't feel good in all
Yeah.
realms. Imagine waking
Yeah.
up and not feeling well. That really,
Mm-hmm.
and we'll get there too, because I'm a patient too. Like, I'm not just a nurse. And that's a big part of like another reason why I'm the nurse that I am today and the educator I am today. I have 5 chronic illnesses. I wake up every day and I don't feel good. You know what I'm saying? So,
Mm.
like, if you're going to be a nurse, you have to understand, like, sick people don't feel well, not just physically, but also emotionally and mentally and financially. You can't just wake up and say,
Yeah.
I want to be a nurse because I want to make money. You got to care for these people.
What you
You gotta
said?
care for these people because they can't care for themselves and they need
Right.
support, real
Yeah.
support.
Yeah.
So you might wanna change that. And then you thinking that nurses make good money, they make okay money, but for what we have to put into it, we don't make enough.
Don't make enough
We're
at
not
all.
making enough at
Nope.
all.
At
And
all.
then now I'm finding out we're not making anything. Like, how is it that I've been a nurse for almost 10 years and then the offering pay that I'm getting now, even as an educator, is the pay that I was starting off with 10 years ago?
Mm.
How did we go
Stop.
backwards?
Mm.
That's crazy. That
Yeah.
is crazy.
Yeah.
So
It's
now
backwards.
y'all might
Yeah.
wanna look into something
Do
different.
something else. Yeah. And with the program being so rigorous, like if you have to go through all that stress just to get to the other side of nursing, to get your licensure, why put yourself through the stress of joining the profession, which they are now saying is not a profession, but we don't need anyone to tell me who we are, right?
What?
Like,
What are you talking about?
have you not heard that nursing is not a profession, not considered a profession? And therefore, government is not acknowledging, or they're reducing the funding for advanced degrees for nursing. So more like medical providers, they will still get X amount of funding a year, but they have reduced the amount of funding made available to nursing and other groups up under the health profession. I think it affects therapists too. So, yes, friend, where have you been? You've been busy. Yes,
I have
yes,
been so busy. I'm not even gonna lie to you.
yes,
I'm not on my phone too much these days. I'm
yeah.
trying to build
It's
my
a good thing. It's a good thing. It
nursing
is a
is not
good
a
thing.
profession.
They are, well, it was a poor, for me, it was a poor choice of words of how they said it. And yeah, if you just Google, even the American Nurses Association has made a statement, because when you limit funding for something as important as the nursing profession, who makes up a big, big part of the healthcare workforce, right? People come to the hospital because they need a nurse, not because they need the provider. We can go to
Yeah,
a clinic.
nothing gets done
Yeah.
without the nurse. Nothing gets done.
Nothing gets done
The,
without
the,
the
the
nurse.
red flags, the
Exactly.
clues that piece everything together doesn't get done without the nurse. The doctor comes in, puts the plan together, and we do it. The
Yeah.
the pharmacy makes the medication, but it doesn't get inside the patient's body without the nurse.
Yeah.
So y'all want to do it? Yeah,
Um,
you want me to show you how to do it? I can show you.
yeah.
Y'all gonna do the porta Y'all gonna do
Yeah. Yeah.
y'all gonna do all that?
Yeah.
That's not a
And
profession.
yeah.
That's crazy.
Yes, yes. They're trying to say that it's not considered a profession according to whatever they just passed. So I'm not political, but one thing I'm learning, even in this space, and of course, not being at the bedside, being, just zoned into direct patient care, is that it is a lot. That organizations like the American Nurses Association, like they are out there. They are trying. And so it's important to be a part of our organizations, whether it's local or whether it's
That's just what's
national.
that word? That's that P word, propaganda.
Yeah,
Something like that. It's a money thing. That has nothing to do. That's just that. There's no way people believe that. There's no
right.
way people have to
I
believe.
said,
That's just a money thing.
yeah, yeah. And I don't know
That's
if it's just,
crazy.
I don't know if it's used to like just spark emotion. I'm sure there's a bigger picture to it, as with everything.
I don't think they care about sparking emotion. They put the things out there so that they can justify cutting the funds. That's the whole point. The whole point was cutting the funds. They don't care about emotions. If they cared about emotions, all the things that would happen in this country wouldn't happen in this country. They could care less about emotions. They don't
You're
care
right.
about emotions,
You're
okay?
right. You're
The way that
right.
they handle certain things, even outside of our own realm here, how they handle immigration, how they
Mhm.
don't care about emotions.
Yeah.
They just put the things in order so that they can have their funds or whatever it is that, yeah, it's not about
Their
emotion. But that
agenda.
was
Yeah.
definitely a poor
Yeah.
choice of words.
I know. I'm saying if you were gonna cut funding, you didn't have to say it like
Just do
that.
it. Like, y'all
Yep. Just
already
do
doing what
it.
y'all want to do. Like, you ain't even gotta say all that. Like, ew. Cause
You're
one,
right.
everybody's gonna need a nurse one day. And don't you dare say that it's not a profession, then you need a nurse one day.
Mhm.
No, no,
Yep.
no. Let the doctor come up in here and
Yep.
change your wound and put this foam
Yeah.
on here and seal this wound back after you guys, because you said, let me just be quiet. Let me be quiet. Let me be quiet. Because it's not a profession.
Behave.
Let the doctor come in
Behave.
here and seal
Yeah.
your wound together because they
Yeah.
don't do that. We do
Yeah.
that. I do that. Like, what? That's not a profession? That's
Yeah.
like so intricate. Like,
Yeah.
what?
Yeah. And to set limitations when really you should be giving us even more funding for those who are willing to go to risk it all to practice, right? In an advanced role. I chose education because I did not want to practice on individuals, and education was my thing. Like, I just love for people to see that
Yeah.
aha moment.
Yeah.
But for those who are really taking that step to have a seat at the table with other providers as an advanced provider and help serve their community, why would you limit funding for that when you already don't have enough providers? And they have the ability to bring everything that comes with the nursing role of how to see that patient holistically and know what it's like to take care of them, to do all the things, and now they're able to really have a conversation and provide a means to help treat them. So why would you limit that? Out of all the help that we could take, good help, why would you limit
Good
that?
help, right?
Again, nobody has to tell me. I don't depend on anyone to tell me what I am and what I am not.
Of course
We
not. When
know
you
what
said
we
that, I was like,
are.
oh,
Yeah,
they just the
yeah,
greedy just want to be greedier. That's
yeah.
fine. One day they'll get tired of being so greedy, you know?
Stop, Bria. Bria.
You know, I don't know what else they
She said, I
want. Like,
can't
that's
wait. Like,
crazy. Life is just so much more enjoyable when you're focused just on your dreams and your passions. Like something as,
yeah,
I don't even have a word for it.
yeah,
Money, funds, I don't know, like what thrills me, what excites me, what brings me joy is like community and people and healing. And a student texts me, I passed and thank you.
yes,
And my patient saying, oh, I'm feeling better. You know, the treatment is working and I got my scans back and the inflammation is 99%
yes.
gone. Like
Um,
that's what gets me, not a dollar bill,
right,
not a dollar bill. But I
right.
mean, hey,
It's the connection for me. Yeah. It's
okay.
crazy.
Taught
Crazy.
me something today. What in the world is going? Okay,
Lord.
I'm gonna go on TikTok maybe this weekend.
Yeah.
Okay, I got stuff to
Yes.
do, but oh my
Yeah.
goodness,
Don't
I'm
worry.
shocked.
Don't major in minor things. Don't worry. I feel like I'm watching a movie. I'm like, okay, whatever. 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 Who did
Yeah,
you need during COVID? Okay, whatever. Whatever. Okay.
keep
I
it
don't know.
going.
I don't need to drop any more bombs on you, okay? That's all I know, because I'm not ready. I'm not ready to respond to the bomb that I might drop, okay?
So let me try to
Yes,
woosah. I'm very
I love
expressive.
it. They need to hear it. I really desire for aspiring nurses and new nurses to really hear from those who care. That's what I want them to hear on the other side of this speaker. I want them to hear that same compassion, that same empathy, so that they will have that same drive to go out there. If you're going to take on that nursing badge, that nursing licensure, if you're going to own it, do right by it. Take care of patients. Do the right thing by the people that keeps us employed in the first place. They're the sole reason for our whole job, to take care of them. We have to take care of our patients. When I took care of patients, it was still, when I go into that room and I cross that door frame, I call that my threshold. Hey, I'm in here for that patient. I may not be able to save the whole unit, but at this one moment, I'm in here with you. How are you doing? This is what the plan of care is today, and go from there. But try to make whatever connection it may be for that moment. And, some patients, it's just a matter of just give them their meds, assess them, just do the things. And then, they already don't want to be there. So I'm not going to force myself on them. But then you have some that need that extra tender love and care. So I may just chart standing in the doorway because the patient doesn't have a family member, so it's just those things,
Oh,
not
yeah.
just there to get a check like that. Money cannot amount to what patients need during those vulnerable times that they're in. Because that's when you're most vulnerable. Laying in a bed, looking up at a ceiling with a gown on with no undergarments. That is vulnerable. Vulnerability at its best.
Yes.
Yes. Yeah. Okay. Now, just talking about patient perspective, because I think we just kind of dove right into it. How have your personal experiences influenced your approach to patient-centered care or healthcare in general?
Okay, so kind of like piggybacking what you're talking about, and then like my own personal experiences as well. Like, it is very important to understand one real truth, right? We're all human. The
Yeah.
same feelings, the same
Yeah.
things that you go through day in and day out, your ups, your downs, your highs, your lows, your happies, your sad, your anxious, your fears, that person is going through that too. And they're not feeling well and they're sick. So you have to be mindful of that.
Yeah.
You have to be mindful of that as a nurse. If you're going to go into the job, do you know what that means? Like,
Mm-hmm.
you're just here, right? I'm just here, just doing my tasks, like the whole task list. That's not providing the care that you should as a
Mm-hmm.
nurse, right?
That's good.
And then also from like my personal experience. So last year, I was having my own like health thing, right? And I ended up in the hospital. I was in the hospital 6 months out the year last year.
Ooh.
And yes, yes. So I don't really, well,
Yeah.
of course I know now, but I didn't know what was going on. But I started just having like these various symptoms like vertigo, ringing in my ears. And then at one point, my vision was just double all the time. I just really
Mm.
couldn't understand why I was just seeing double vision. And then one day I was driving to see a patient, and all of a sudden, I couldn't understand. I couldn't catch my breath, and then I had to pull over. And then I had my blood pressure cuff, and I checked my blood pressure cuff, and it could not get a reading on me. I had to call 911 right there on the spot, and
Wow.
they took me to the hospital. Long story short, I had to get a lumbar puncture, spinal tap, because my ICP was 32, and their normal
What?
range is 7 to 15.
Now it's time for a quick nurse note, a moment to pause, reflect, and reset. Sometimes healing isn't just physical, it's spiritual. It's the quiet courage to sit with someone in their fear. It's the grace to speak life over a student who's ready to give up. And it's the reminder that even when we feel inadequate, God equips those that he calls. Bria Burley chose healing as her why for nursing, not just healing bodies, but restoring confidence, renewing purpose, and reminding future nurses that they are never alone in the process. Scripture to reflect on comes from Psalms 147, verse 3, where God says, he heals the brokenhearted and binds up their wounds. That is hands down one of my favorite scriptures that I leaned on in some challenging times in my life. But in every tutoring session, Bria is doing more than just teaching. She's tending to the unseen wounds of doubt, anxiety, and burnout. She's proof that healing can happen in a Zoom call, a study guide, or a whispered prayer right before taking an exam. So, question, where have you seen healing show up in unexpected ways? What moment reminded you that God still works through your hands, even when you feel empty? All right, let's get back to the conversation with Miss Bria Burley, our founder of RN Prep Bestie, because this next part is where her story meets her mission.
So I was diagnosed with this chronic illness called pseudotuber cerebri. So basically, my body
Mm,
produces too much cerebral spinal fluid, and there's no known cause. It's idiopathic. So
wow.
I was in the hospital for that. And during my stay, and I'll say this too, some nurses have have compassion, right? Some nurses are nice, but it's not just enough to be compassionate. You also have to be competent and knowledgeable, because the nurse
Mm.
will come in and be like, "So what are you here for?" And I'll tell them, and they'll be like, "I've never heard of that." And after a nurse tells you like they have no idea like your condition, just kind of makes you feel like, do you know how to take care of me? Like, I'm scared. Like, even me as a
Yes.
nurse, like, I don't know what's wrong with me either. And then you're a nurse and you're as sweet as pie, but you're just like, I've never
Mhm.
heard of that. And that's just so weird. And then in the ER the whole time, people are walking past my room and they're like, she has the mystery illness, like outside of my room, door open, mystery illness. Yeah, I'm in a gown too with my booty cheeks just out, no undergarments on. Like, I'm in there just crying the whole time. I don't know what's wrong with me. Like, my world
Yeah.
just changed upside down. Like,
Yeah.
in the hospital, I had made an oath to myself, I'll never be a nurse again. I don't know why. I went through all the stages of grief, like one by
Oh my
one. I was
God.
denial, angry, sad, bargaining. But one thing for sure, for that
Mm.
experience, I was like, I'll never be a nurse again. I don't want to be a nurse again.
Mm.
And I was like, what patient wants a sick nurse? What patient wants a sick nurse? But
No.
I overcame that. But my experience there was so terrible because people were not competent. Nobody knew what was wrong with me, not even the providers. Providers would come in there and be like, we don't know. We don't know what's wrong with you. But and it's nothing wrong with people not knowing what's going on with you, but it's like how they say it. Like,
Mhm.
don't just be like, I've never heard of that. There are times where I've been on the job where I might have had a new pump or a new medication that I might not have been familiar with. Or if a company says, hey, are you familiar with this?
Mhm.
I'll pull up my phone, pull up a video, go in the bathroom, and be like, let me go wash my hands real quick. I am
That's
now.
it. Yeah.
Yeah, it's as
Yeah.
simple as that. Don't tell the patient that you don't know what you're
Yeah.
doing. How does that
Mm.
reassure them? Like,
Yeah.
you literally just said you were incompetent to my face, and you're my
Yeah.
nurse for the next 12 hours. If something happens to me, because at this point, I've been driven to the hospital, I almost
Mm.
lost my eyesight because that's what can happen with this condition. I had to have emergency spinal tap. That was traumatic in itself. Like, I don't know what's happening to me. I can't trust you that you're going to be able to recognize when I'm escalating or, you know what I'm saying?
Yeah.
And that experience also told me, like, it's not enough to just be a nice nurse. You also have to be
Mm.
a competent nurse as well. So that's important too for the nurses to know. That goes with the clinical
Yeah.
judgment and knowing
Yeah.
more, than just, I need to be sweet. I need to be nice. Like, you
Mhm.
also need to know what the heck you're doing, and don't
No.
tell a patient, I've
Yeah.
never heard of that before. That's da 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 da. Da." We can't
Mhm.
because people get scared. Like, the rest of the
Yeah.
whole hospital thing for me, I was like, no, I was terrified. It was a really bad experience because there is a really big problem going on with people just not understanding things. Like, I don't know how they're still passing exams and getting certified, because after I left that hospital the first time, 2 months later, I was back with the same issue. So I had to get another lumbar puncture. So I had to get the second one, and then I left. So after the second lumbar puncture, I went home, and like the next day I had like a really bad headache. So it was like the worst pain I ever felt in my
Mm.
entire life. Keyword, worst pain I ever felt in my
Mm.
entire life. What do they teach us in school about when someone feels the worst pain that they've ever felt in their entire life? That's not okay, right? So I
Right.
went to the ER and I told them that. They said, well, you just had a lumbar puncture. That's expected. And they sent me home. They sent me home. Okay. Lost my mind, lost my mind, lost my mind. On the way home, lost my mind. Literally, my mom was terrified because all I did, I laughed the whole way home. I just laughed. I
Mm.
Joker, Harley Quinn laughed my way home. Okay. Went back the next day because the pain it was still the same. It was like somebody just kept slamming me with the ice pick in my head. Went back the next day and they were like, fine, we'll just give her a scan just to shut her up. Subdural hematoma in my brain. Tongue slurring, jaw numbing. I was stroking out.
Jesus.
I had a brain bleed after my second lumbar puncture, and they sent me home.
Mm.
Yeah. So how do y'all do that? How do you do
Mm.
that?
Mm.
How are we missing these easy clue details? Like, what are we doing? What are we not doing in the emergency departments? What are we not doing for our patients when they're coming in there? Why are we not listening to our patients when they're saying, we know our bodies? And let me tell you something too. I will never, every time I go to doctor, clinic, hospital, whatever, I never say I'm a nurse.
Mm.
I don't even say I help people. I don't say nothing. I'm a regular person
Wow.
off the street for as much as you know, you don't know what I do.
Wow.
You don't know. I don't tell people I'm a nurse. I never tell people I'm a nurse
What
because the
makes you
treatment is
say
different.
that?
When you tell people you're a nurse and they expect you to know how to take care of yourself.
That's good.
Yeah, this
That's
literally
good.
happened to me. Yes, literally happened to me. So I was just like, okay, how did this happen? How do we miss simple clues like that?
Mm.
So what's going on in the hospitals that we're not doing, where we're missing, like we're not even listening to the patients?
Yeah.
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 So
And dismissive about it.
dismiss it.
Dismissive. And we've seen a lot of that in the news too. I can't even mention it because you're gonna really, you might get up and walk off on this one. You're gonna have to look into it. And I actually did not watch the video, but there was a video of a lady who was in labor, and basically the nurse was not concerned about the patient in labor, like telling you I'm in labor. And it appears from rumors that she was just very dismissed. And then, of course, other people mentioned how they were in active labor, got sent home. And one lady, I think, had her baby on the side of the road or something like that. But I think that was like a different time. But something is now in the news at the time of this recording where a woman of color was in labor and someone was videoing it, but I didn't watch the video personally. I don't. First of all, I know me and I know my heart. And so I did not watch it. And like you said, when you're trying to accomplish things, you're not really just all in to just news and all that. But there's just like you said, like how
There's something going on. And that whole time that I went through all of that, not a Ketorolac, not a acetaminophen, not a nothing, not a nothing, not a nothing.
Mm.
But let my counterpart, I have counterparts that just have little ouchies and boo-boos. Norco, Dilaudid, morphine, I
Mm.
never received nothing for my pain that entire ordeal. Never
wow.
received nothing for my pain.
And
Even
you
now, like
verbal.
my diagnosis is considered a disability. It's a chronic illness, and I cannot get anybody to give me anything for the pain that I live with on a daily basis. I have fibromyalgia, I have endometriosis. I cannot get
Mm.
any doctor to give me anything. It's like, why is that? I know that's something totally different from what we're talking about, but it's kind of in the same realm. Like,
Yeah.
why we can't get no care? Why we can't
Yeah.
get no help?
Yeah.
That's
It's
crazy,
it's
right?
whew. And another thing that you mentioned, first and foremost, I'm sorry that you're even experiencing that. Man.
I don't really have much to say about it anymore. I went through that whole feeling sorry for myself. And I feel like that's another reason why, like, 6 months out the year, I was not living. I was not alive. And that's another thing nurses have to realize. Like, these patients go through so much. A lot of them just waking up every day is a struggle, like it's a mind thing. Like, it literally took me so much willpower to be where I am today. Like, the testimony that I have where I'm at today, rebuilding my business after going through that to
Yeah.
where I
6
am now,
months. Yeah.
getting
Yeah.
diagnosis after diagnosis after diagnosis and being turned away and not getting the help. I had to rehabilitate myself. The doctor's like, well, we don't know what to tell you. We don't know what you should do. You know what? I got Chat GPT. Figured
Yeah.
it out myself.
Oh,
Figured it out myself.
uh,
Figured it out
and
myself. I
literally
was on
had to lean
12
on your
meds,
own.
and now all I take is just one pill. That's all I take a
Come
day.
on.
Yes,
Oh,
did it
God.
myself. How about that? Thank you, Chat GPT. Thank you, God, and thank you, me.
Yes.
Like, yeah,
Yes.
yeah.
Oh,
But we got to
God.
do better because
Yeah.
healthcare and nursing is supposed to be about the patient.
Mhm.
Where's the patient centered in all of this?
That part.
It's supposed to be about the
Yeah.
patient. They're supposed to be owning their experience and saying, hey, this is the help that I need. Can you help me? How come they don't get to pick and choose the type of help that they get? Like, where is my treatment? Like, yes, you write a treatment plan, but how are we
Mm,
implementing this and how is this actually helping me?
yeah.
And if you don't know how the answers, what are you doing to figure it out? Like, just
Yeah.
something, like, give me
Yeah.
some type of help.
Yes. And like you said, just going back to the root cause analysis, there's a couple of things that has to be done. Don't just treat symptoms. Figure out why I'm experiencing this. And with your treatment, make sure it works for me. Make sure it works for me. Make sure I can actually get to the place that you're telling me to go to get the services that I need. Because it may look good on paper, it may look good on your chart, on my chart, but then I become non-compliant when I'm unable to fulfill the treatment plan. When really I'm
Mhm.
not non-compliant. I don't have the ability.
Resources, yeah. That is
Ugh.
so important. That is so important.
Girl, we done went so deep. Bria.
I knew this was like, dang, I'm a different type of person. I'm a different person. I'm like, ooh, she
Mm,
picked. I don't know if she picked the right one or the wrong one with me because I'll take it there. Like, there's so many
yeah.
things. Like honestly, like how on a computer, right? You go
Mhm.
Control Alt Delete, right? And you have your
Yeah.
task manager, and you can just end task and
Yes,
restart. Can we just healthcare just put that? Let's start it over because I
baby.
know Florence Nightingale did not. I know she did not think about this when she was
Right.
trying to build nursing and all the founding fathers and stuff like that. When I teach, I sometimes I teach. I work with the workforce and I teach these
Mhm.
night classes, and we go over medical history and healthcare history. And I'm like, I know these people did not think that it was going to end up like this. Like, well, now it's for profit. This is a business. How are we turning healthcare into a corporate business? How is a life-saving medication $14,000? You are billing the patient $14,000. And to be honest, I always tell my patients, if I could do this job for free, I would. But to be honest, you're paying $14,000 for the medication where you wouldn't even get the medication if it wasn't for me. And I come in here and I get $100. Make it make sense.
Mm,
But it's okay. I don't, that's not even me. You know what I'm saying? But still, it's just like the disconnect. You know what I'm saying? Like y'all have really turned this into, now I'm looking at the marketplace to try to get myself insurance because I'm considered self-employed. I can't work full time. I can't stand on my feet more than 5 minutes. I chose this career because I love it, but I'm a chronically ill, could really apply for disability as a registered nurse. I have to get marketplace, and Aetna said, we not fooling with y'all. We don't.
mm.
There's no plans on the marketplace right now. So it's like I'm
Wow.
looking at health insurance for myself next year and I'm like, I don't really have a lot of options. Yeah, it's getting really bad all around in all
Yeah.
aspects. But as
Yeah.
far as like nursing goes, we could definitely do a whole lot better as far as like how we care for the patients. We could do so much better to make that experience that the patients already have to deal with having to pay so much and they're already feeling upset about that and insurance
Mhm.
and big pharma. We could do so much better with how we treat people. Like, don't
Yeah.
forget where you came from. And don't forget
Yes.
the reason why you're here. You know what I'm saying? Like,
Yes.
these are people, this could be your mom, your dad, your sister,
Yeah.
your favorite person in the whole world. This could be them. Treat them like you would treat that person.
Yes. Yes. And don't work in silo. Like, we have to come together as a nursing community. We have to. And I know it's hard because if you're working in the hospital and working at the bedside, when people say, oh, I know you love working just 3 days a week, 3 12s a week, baby, you may go to hell and back in those 3 days and you need 2 of your days off to recover. But in that, you're too busy, honestly, struggling to help take care of patients during that time, that you don't have it is hard to step away from that and say, oh, well, let me get my cup of coffee and let me look up um on healthcare policy right now and see where I can write my senator, right? So I get it. I get it. Like
It's a
it's
lot.
it's a lot.
Yeah.
It's
It's
a
a whole
lot.
lot.
It's a lot. And so I'm glad to have this podcast so that
Yes.
I can get more Brias on here and and really speak in love and in truth. And honestly, it's off your own personal experience too.
Mhm.
And so this is not, hey, what I think. This is not what Bria thinks. No, this is what Bria is actually living. And this just shows you that we cannot take anything for granted and to be grateful for what we do have, because we never know what a day may hold. You never know when you may become a patient. You never know what that's going to look like for you. And so I just commend you, because through it all, you didn't let that break you, but you made the choice to continue to live with purpose, to continue working in spite of.
Yes.
In spite of. So you got to pat yourself on the back for that one. You are definitely a queen.
Being a
It
nurse
is.
is a blessing. I really don't think that if I wasn't a nurse, I would be where I'm at right now because everyone, like, I'm in like Reddit support groups,
Yeah.
all on disability, all in the bed,
Wow.
nobody works. Okay, the people that are working,
Mm.
all work in healthcare. So I feel like the people that are knowledgeable or the people that have like healthcare backgrounds, for some
Mhm.
reason we're able to kind of like push through and like we're still able
Mhm.
to work. But other people, they don't get out of bed. They don't get out of
Wow.
bed. But it's hard. It is hard.
Yeah.
I will say when I first got diagnosed for 2 months, I didn't get out of bed. It was hard, like migraines every day,
Mm.
and it was really hard. But now I'm like, I am so thankful.
Yeah.
This was actually really good for me. I really needed this
Yeah.
because
Yeah.
I really needed this
Yeah.
conversation. I need to talk to people more
Yeah.
often. All I do is sit.
Yeah. I feel grateful too. So I'm gonna hit you with this bonus question while we're here.
I'm ready.
If every nurse had to
Okay.
carry one mindset into every shift, classroom, or exam room, what would you choose and why?
Oh, mine. I don't feel like this is the best one, but I mean, this is the only one that comes to mind. Let me work it. So my mindset is like your experience is what you make it. That's my mindset. Let me elaborate just a little bit. So your experience is what you make it. So it translates in all of those place spaces, right? So in school, nursing students, when they do their consultations with me, I ask them about their nursing journey. And the majority of the students tell me like their nursing school experience was terrible. I like to tell my students, you have to own your experience. Not every experience has to be negative. You can make it positive. Just because like there are obstacles, there's so many resources now. You can own that experience. You can literally make it positive. If your school is lacking in support, find your support somewhere else. We got TikTok, we got Chat GPT, you got other people out there. There's people out there that want to help y'all. And most of the help is free. You don't always have to pay for help. You can make
Yes.
make the most out of your experiences. And to be honest, that's also going to help you with building your own critical thinking skills anyways, right? In the workplace, if you're struggling with your 12-hour shift, you need to do some thinking yourself too and figure out what's the best way that I can make the most out of my shift. You do something that I do as well. When I did do bedside, I would figure out which one of my patients was the one that needed me the most, or my dementia patient, the one always trying to get out of bed, pulling stuff, the one that's always hitting the call light. Once I do my rounds, pass my meds, do all my skills, I'm coming up in here and I'm gonna sit with you.
Yeah.
We're gonna watch the Golden Girls. We're gonna watch I Love Lucy because I work night shift. Night shift was my
Yeah.
thing. And I'm a
Yeah.
chart and we're gonna talk and we're
Mhm.
gonna sing, we're gonna put some music on. And that's
Yeah.
what made my shift go by. I made
Yeah.
sure as a nurse working on bedside, I spent time with my patients. I wasn't the type of nurse that sat at the nurse's station. I just couldn't do it. I don't do idle. I cannot do
Yeah.
idle. So I always made sure that I found a patient that needed me the most. And that's who I went and spent my time with. And I also you just made the experience what you needed to. I
Yeah.
made bedside fun for me. If I was able bodied, I would go back to bedside. I would. I miss it a little bit. I do miss it a little
Yeah.
bit. So you make the most out of your experience. And
I
that and
like
that's
that.
honestly the mindset that I feel like works the best. You can control your environment, you can control your experience, but you have to make the most out of it.
Mm. That's good. That's good. Say it again. You make the most out
You
of
make
your
the most out of your
experience.
own experience with your
Yeah.
attitude, with your actions. You
Yes.
don't conform to what everybody on TikTok is saying. You don't conform to the classmates that's all complaining about the school and we don't like this teacher and they not teaching us nothing. Go figure it out. Go
Go
find
figure it
support
out.
community
That's
somewhere
good.
else. You don't have to
Yeah.
conform to that because if you make your experience negative, it's going to always be negative. Then you're going to live in that and then it's going to follow you and energy is going to attract to you. And that's what it's going to be. You're going to be like, that teacher
Mm.
don't like me. She want me to fail. No, you failed because you failed. Okay. You can't put blame on
Yeah.
everything. You know what I'm saying? Your experience is what
Yeah.
you make it.
Yeah. That's good. So as we wrap up this episode, tell us about RN Prep Bestie and
Now I'm shy.
yeah.
Everything that I said, now
Yeah.
I'm shy. Oh my
Yeah.
gosh. RN Prep Bestie is my nursing education business that I started back. Like I started just tutoring students just for fun, just because like I told you in the beginning, I like a challenge. That's just me. So
Automatic.
I started RN Prep Bestie because when I was in nursing school, I did not pass my exit exam the first time. I had to retake it. So that made me have to sit and reflect and see like why I didn't pass this exam. And then I did recognize that I had test taking anxiety. So that was
Mhm.
something that I had to work on within myself. And then that kind of sparked something in me too. And then like the whole education route There were also other people that weren't passing NCLEX, and I just started tutoring people. And then I was like, I'm going to start a business.
Mm,
And so the business started from word of mouth. So I helped one
Mhm.
student virtually, and then she referred me to a friend, and they referred me to a friend. My
come on.
business was pure word of mouth. I had never, ever had to market my business ever. It was like, okay.
Amen.
And as soon as like I would sit down and would get quiet because I was still working, working as a nurse right before, all the chronic, health conditions and stuff. I would just be like, okay. And it wasn't anything that I truly focused on, but I did all the things to make it like a legit business,
Mhm.
got the LLC and stuff. But it was a side thing. And then it just kept growing, like just kept growing.
Wow.
But then when I did get sick, then word of mouth kind of stopped because I did have to stop doing, tutoring. Well, then I was like, well, now that I can't really do, nursing work too much because, my condition, keeps me from standing on my feet too long and all the other things. I want to pour into this more because I will say every student that has ever experienced me when I was tutoring, they all passed. I had 100%
Come
pass
on.
rate. Nobody was failing. You know what I'm saying? Everybody was passing. So I was like, well, let me
Wow.
do this because I feel like maybe it's a calling. Maybe this is for me. And then I started realizing from my students, they will always say, "You challenge me. You challenge me. You
Mm.
make me see this differently than I ever saw it before." And I never thought of it this way. And that's like, you know what? Then this is what my brand is. Okay. So
Yeah.
RN Prep Bestie is a service that will challenge you. If you are looking for shortcuts, if you're looking for what's going to be on the test, honey, I'm not for you. And
Come
that's
on.
simple. And that's what my
Yeah.
consultations are for. I need to see what I'm working with, okay? Because there are times where students aren't
Yeah.
aren't a good fit for me, and also I'm not a good fit for
Mhm.
you because of what you're needing, okay? I'm not quick fix easy. I challenge you. I
Mm.
can make virtual clinical assignments. You're going to get a patient scenario with a matching video, with a clinical breakdown with their vitals, reports, provider orders, and you will have to answer questions. We're not doing practice questions. You're going to have to record your answer choices, submit them
Mm.
to me. I will review them, and then we will go over it
Come
together
on.
because that's how you're going to be a nurse. You're going to have to practice how to call the provider. You're going to, yeah, S bar. Remember that?
Come
Yeah.
on.
Y'all gotta
Yeah.
be confident in yourself when you're calling the
Yeah.
doctor. You have to be confident to say, oh, well, the patient's electrolytes are this. Hey, this is our patient in room, blah, blah, blah. This is what's
Mhm.
happening. And I need these orders. Do you think, is there, I break it down. There's so many different
Yes.
assignments and interactive games that I do with my students in their study plans. And then we have our one on one sessions together where I go over different nursing content, but I break it down in a way that's not textbook. I don't use medical jargon in my tutoring
Mhm.
sessions because y'all get that enough
Yeah.
in nursing school. So I
Yeah.
make things relatable. Like when we talk about diabetes, insulin is the key that unlocks the doors to your cell to allow in glucose. That's the kind of stuff we do. We break it down. Everybody knows what a key is, everybody knows what a door is. I like to make things simple for people to understand and that's also the way that we need to educate our patients. Our patients don't have that kind of background knowledge. So we have to
Yes.
educate them in that way as well.
Yes.
So my tutoring is very laid back. It's fun. If you're trying to do 150 questions a day, baby, we ain't doing that.
Yeah.
You
Uh,
That's just not me, okay? So I've been spending a lot of time trying to revamp my business and provide just high quality tutoring materials. So actually, I'm about to launch out a group course. December 15th, I'm launching my group course. It's called Shifting
yes.
the Mindset. So it's going to be a 4-week course where students are going to shift away from recall and memorization and start thinking like nurses. And each course has a study plan that aligns with it, with those virtual clinical assignments and games. And then I'm also going to start launching just study plans to put on my website that students can purchase that also have those virtual clinical simulations that they can do as well to help them put the pieces together and just to help them in all kind of categories like growth and development, maternity,
Yeah.
fundamentals, and I'm almost at 1,000 followers on TikTok. So once I get to 1,000 followers, I'm going to do my first giveaway. And I'm actually going to give away one of the group course to a student. So yeah,
Come
I'm going to give
on.
away a whole course to somebody. So I'm really
Yes.
excited for all these great things to come up with while I'm still tutoring students. And I just had a student pass her NCLEX yesterday. So congrats
Yeah.
to Trisha. Woo! She took her NCLEX and she was a word of mouth referral from her friend Kay, who's on my TikTok. Kay took her NCLEX in September and passed. And then she referred her friend Trisha, and then Trisha tutored with me for 2 months and she passed yesterday. So it's like
Yeah.
the best friends are both nurses
Come
and
on.
I love what I do. I love
Yes.
this job so much. It's just amazing.
Yeah.
I have a lot of great things coming. My thing is just that it the students have to trust it. The students have to trust the process because I am different and I know that I'm different and I tell myself that on the days where it's like, oh, you're not getting a lot of traction. You're not getting a lot of, students that are interested in your business. And I just tell myself, it's just because I'm different. A quick, question bank. I'm not UWorld. I'm not Archer. I'm not that, but what I do works. So if
Yeah.
you're somebody that is struggling to pass NCLEX and you want something different, you want a different outcome, you have to do something different. And that's what RN
Yes.
Prep Bestie does. Like, I'm getting you
Come
guys to
on.
pass because I'm making you think critically. Let's learn how
Yes.
to think like nurses.
Yes.
Working really hard.
Man.
I'll get back on TikTok by then. I'm just working because I am. Another thing I'm thinking about too is like the students kind of need to see the product. So I'm working on like a free sample that I'm going to post out there,
Mhm.
and then just so that they can see what the products look like.
Yeah.
So I've been burning the midnight oil. So when we get done here today, I'm actually going to get back to it,
Get
and I
back
have
to
2
it.
students that I'm working with right now. So it's like I'm doing a lot of. And
Yeah.
then I teach 3 nights a week, and then I still do
Come on.
infusions. Like, what, who do I think I am? Who do I think I am? I am one person. Like, but then I'm
Yeah.
still blessed every day. I'm like, my body hasn't fallen apart yet. I'm
Come
still
on.
here. Like, it's really a mind over
Yes.
matter thing. Like,
Yeah.
and then I'm just pouring into myself and I'm pouring into people. I did take 2
Yes.
naps today. And I do pour and I do take my naps. Okay. One of those ones. Yes. Yes. My 3 to 4, that was for this, for sure.
Yes. Thank you
Thank you so much
so
for inviting me. I feel
much.
so special.
Yes. So I am just honored. I am so grateful that you blessed us with your presence, with your wisdom, with your experience, just all the things, Bria. You have truly blessed me more than you'll know. We don't even have enough time to unpack it on this episode. So I am just excited for what's to come. One, thank you for all that you're already doing. And I'm excited for what is coming because you have just been consistent. You've been doing all the things and nothing has been wasted. I think that is just awesome. So tell our lovely listener how they can find you.
Okay. You can find me on TikTok, RN Prep Bestie. You can also search my website, rnprepbestie.com. Those are the main places that you can find me right now. That's where I post. That's pretty much it. It's just my website and my TikTok. And I will be working harder on posting more regularly. Social media is just, and anyone that knows me is like, oh, she's not a big social media person,
Hmm.
but I am working on it because as you can tell, I
Yeah.
have a lot to say. I have
Yeah.
a lot to say. I need to, so
You
I'm
do.
working on getting a little bit
Yes.
more out there too.
Yes. And look, but thank you so much for joining us on this week's episode of the All One Nurse podcast.
Thank you
Yes.
for having me.
Yes, ma'am. And I will list all of your links and how to connect with you in the podcast description below. Well, that's a wrap. And I just want to give you some quick updates. First, the All One Nurse Mentorship Program officially launches on January the 1st. Early bird registration is open right now. So be sure to go ahead and head on over to All One Nurse Linktree or the landing page on alloneNurse.com to go ahead and secure your spot because we're only accepting so many spots. You'll find all the details listed in the form on Linktree. If you fill out the landing page, then of course you'll find out all the information in a follow-up email. Second, I'm still updating the website, okay? And it's coming soon.
It will be a fresh space where you can access resources, mentorship opportunities, and connect more deeply with the mission of All One Nurse, which is to support you as a nursing student or first year nursing grad. This space is for you because a lot of times, a lot of new nurses, what I am witnessing is that you experience transition shock, and there's still this stress and this anxiety. So not only were you jumping hurdles through the program, the nursing program, but now that you're coming in and facing a whole nother beast after NCLEX. And so this space is built for you. And as we step into this holiday season, I want to wish you a Merry Christmas and Happy Holidays. My prayer for you is that 2026 will be filled with joy, growth, and new opportunities. May your faith in God grow bigger. And even if you're not a believer, because this space is for everyone, hands down. And I always say, lean on my faith if you're not a believer, right? But this space is for everyone. And even if you're not a believer, may your personal development flourish and may your professional development flourish as well. And may you walk boldly into the new things that has been prepared for you. Now, thank you for spending this time with us today and being a part of the journey. Keep choosing faith over fear. Keep moving forward in spite of challenges, in spite of obstacles that may be meant to force you to quit or enough to make you want to quit. You've come too far to give up now. You are never alone on this nursing path. Until next time, let your light shine. And I look forward to seeing you in season 4 of the All One Nurse podcast.